bachelor degrees in nursing, and I am here today because of the injustice that was meted against nurses. First of all, I want to say this to all Kenyans, that injustice in healthcare is the most inhuman form of injustice in this country. And I wish to say that justice delayed is justice denied. First of all, it was found out that there was 42 nurses who were not appropriately listed on the internship posting that was done by the Ministry of Health. In this regard, I wish to tell that all Kenyans that you are, even us as the interns who are requesting to be posted, we are not at the greatest risk, but you are at the greatest risk. Because number one, if you remember that they are posting nurses who have not completed school. Number one, I wish to tell you that those nurses have not completed their 4th-year studies. They have not done critical care nursing. They have not done palliative care nursing, and they are going to take care of cancer patients. How can those students who have not completed their studies take care of cancer patients? Simply, we are saying that Kenyans, we are going. The Ministry of Health is promoting irregularity in the nursing program. Number two, I wish to say that recently the Minister of Health, Aden Duale, suspended the Nursing Council CEO, Dr. Lista Onsongo, which means that there is no way you can suspend the Hausa and you don't suspend the script that he promoted. Meaning, suspend, we say that as nurses who were not posted, the 339 of us, we say that since you did not, you suspended the nurse who was in charge of the list, we also say that suspend the list that the other promoted, because that is an irregularity in itself. And I wish to reiterate that Cap 185 of the Kenyan Constitution, it says that the Public Service Commission Act and the Public Service Regulation, it does not give a stipulated number of interns that are supposed to be posted. So I beseech our Minister of Health not to use that as a scapegoat, because we understand the law and we know that the Constitution of Kenya does not provide that only 2,000 nurses have to be posted. So post the 339 of us, because that one is not in the law. We just say the only role of the Public Service Commission is to approve the list that is to be posted by the Ministry of Health. So I wish to say this as I conclude, that we are not going to relent. We are going to be on the streets from today, even next week, all of this month, because what is happening is an injustice to nurses, in an injustice to all the country. Because if a nurse withdraws his services today in the hospital, there is no work that is going to happen, because nurses are the backbone of our healthcare system. So I wish to ask our cabinet secretary that, telling us that we wait for another year and we completed our studies in 2024 is just but a very insane act, because we cannot wait for another year. Me waiting for another year means that I've stayed outside for 3 years, and you know that nursing internship is a prerequisite for you to be a licensed nurse in Kenya. So please, we as comrades, we have decided that until the day that the government will listen to us, we are not going to relent. We shall stay on the streets. Thank you very much.
Okay, my name is Brenda. I'm a graduate, Bachelor of Science in Nursing, and I have a lot of frustrations. But to start with, I want to understand why and how. I want to understand the criteria that we use to post nursing interns, because when you look at the number of graduates we had last year, I do not understand as an individual why 75% to 90% of my classmates were posted, yet I was left out. You look at the Nursing Council of Kenya, it has verified me as a nurse with an index number, and that is the criteria they were using to verify students. What happened that I have an index number, my colleagues have index numbers, they've been verified by the council, they graduated with a Bachelor of Science in Nursing degree, which is the criteria and the eligibility criteria, to be precise, that is used to post interns. What happened that you have 339 students being left out? We have a lot of frustrations, but first of all, we want answers on the criteria that was used to leave 339 eligible interns outside. So
basically what you're saying is there was favorism in posting.
Yeah, they suspected corruption and discrimination. Because if you look at me and you look at my colleagues, you see person X and person Y, we both have met the criteria and the eligibility. What happened? Why are we not being posted and the rest have been posted? We sat in the same class, we did the same examinations, we were given an index number by the same council. what happened in the process. What happened at the ministry that I'm not in the internship list? Why the 339? And talking about the budget, 339 is such a small number compared to what the government can do. When you talk about funds, we cannot take it as an excuse that there is no budget for us. That's such a small number. 408 million is not a huge figure for the government. We want justice and we're crying for justice. It's a big frustration. It's been 4 weeks. We cannot sit here stranded. We cannot be visiting the ministry every day without answers. Yeah, thank you.
Does not respond to the demand, forcing us immediately. Next week on Tuesday, we are going to Parliament. We are going to draft a petition. We have a lawyer who is going to draft a petition that will take to the chairperson of the Health Committee, Dr. Nikal. And he has assured us that he will be there to receive our petition. And they will do an investigation into this matter. They will do a complete audit. They will cross-examine the cabinet secretary and ensure that he gives us answers to the questions that have been asked. Because we have had cases of irregularity where 42 students made it to the list of interns and leaving out 339 qualified nurses. So those are the discrepancies that we have noted in the PSN internship list, and which indicate that the nursing internship list, a process of posting, was not credible, because how come students made it to the list? So the whole process was shambolic, was chaotic, was barbaric, and we demand that the whole list is audited and is overhauled so that we have justice for those who have been left out and they are eligible. So,